Hi, ladies and gentlemen. It's Dr. Julio Novoa. Happy Sunday. Today's the 3rd of April. I wanted to take a few minutes of your time because I appreciate everyone that follows me on Facebook, and I do also post on Instagram and on TikTok. And one of the comments that most often is stated is that, hey, don't forget about us in the mesh group. Don't forget about us in the Felshi group or the breast implants, vaginal meshes. And so if we could start on one common theme, I think that's so important because I don't forget about anyone. When I talk, I've generalized the term of biological implants because any and every biological implant that's placed in the human body has the potential, or in many cases, a significant number of complications related to a foreign body reaction of that implant. Your body realizes that that implant shouldn't be there and does everything that it can to get rid of it or to mount an offense against it. If you remember that basic concept, you'll understand why all biological implants are inherently or potentially not safe, and the longer you have that biological implant in your body, the more likely it is that you're going to have a complication to it. The easiest ones to talk about are the breast implants, or the Felshi clips, or the eShore permanent sterilization device, the hernia meshes, the vaginal meshes, the tension-free urethral tapes. These are the top, but there are so many other ones that you can talk about. And even though I do, as just so that I can tell you, to be honest, although I do put in breast implants, although I do put in IUDs, there is an extensive informed consent related to that, and I follow closely behind my patients. And there are some patients, the majority of my patients, that I don't even recommend these particular devices to be placed. What's also important is this. I don't expect you to follow me because I'm a medical doctor, okay? I am simply trying to provide as much information as I can on a particular subject. And I feel that the easiest way to do that is to take an article already written by someone else and critique it with my opinion. Because I want you to remember this as a second point. Just because a doctor has a medical degree, whether or not it be a medical doctor or doctor of osteopathic medicine, okay? We have to earn your respect that we know what we're talking about, okay? Do not assume, don't ever assume that just because a doctor has graduated from a medical program, that their opinion is the correct opinion. They may be able to put together some facts and come up with the correct answer, but never assume that it automatically is simply because they're a doctor, especially when it has to do with biological implants. Especially when it has to do with biological implants. Because despite the fact that I've been researching biological implants and their complications for over 10 years, okay, you can't ever know enough about it. And I can assure you, as an OBGYN, if you're going to another OBGYN, the amount of information that they know about biological implants is minuscule in how much they really need to know when they're talking about managing your care. I always say this. Don't ever let a doctor tell you that your biological implant is not the cause of your problems, okay? Because there's no test available that can confirm that. That is an opinion based on guessing. That doctor is not a biological implant expert. That doctor does not design biological implants. That doctor is an OBGYN or a plastic surgeon or a family practitioner or emergency room doctor. None of us, none of them, none of us are so good, so skilled, such experts that we can negate what your biological implant is doing to you. So never let that be the answer to your questions related to your pain and suffering, your questions about these strange symptoms that you're feeling, these questions about what I talked about before about depression. Don't ever let a doctor label you with a condition or negate and tell you that your condition is not due to a biological implant, because we don't have the ability to say for sure that that's the case. And when a doctor boxes you into that negative, you're going down the wrong path. You're going down the rabbit hole of misdiagnosis, mistreatment, and a significant delay in proper treatment. So again, my request to you, don't believe what I have to say, okay? Look it up for yourself. And most of the data is clear enough for a person that doesn't have a medical degree to at least fundamentally understand why their implant is causing this problem, okay? That's and so the level of respect I don't demand of my patients, the level of respect that I think that I need to earn from my patients is that particular point, okay? If you come to me, I'm going to tell you A to Z as much as I understand. But if you tell me something that I don't understand or something that I don't know a lot about, first of all, I'm going to tell you I don't know a lot about it. So let me go ahead. Let me do my job. Let me go ahead and research this. And let's make a follow-up appointment so we can talk about it. Okay, I'm not going to tell you that your E-short is not causing your pelvic pain. I'm not going to tell you that your Felshi clip, just because it fell off your fallopian tube, it's not a big deal. I'm not going to tell you that your vaginal mesh, because it's chronically getting infected, there's no problem. We just have to give you some estrogen. Okay. I'm not going to tell you that your IUD is not the cause of your migraine headaches and is not the cause of your intracranial hypertension. Okay, I'm not going to tell you any of those things because I know that I, as a doctor, have got to keep an open mind because my specialty is obstetrics and gynecology. My specialty is not the side effects of biological implants. Okay, remember that. Your doctor is not an expert in biological implants, and therefore don't let them negate your questions and give you a single answer as to how you need to be managed. Keep that in mind. So with that said, and I said that I was going to try to give questions and answers. Don't know whether or not you can really read this, but this says, biological responses to metal implants. And this is where we're going to start. This is a Food and Drug Administration PDF that you can download. You can just type in biological responses to metal implants, FDA, and you can get this 143-page document. It's 143 pages long. Okay? So, what's important in here? Let's take it. Felshi clip group. You've been told time and time again that your Felshi clips can't be a problem because of the fact that they're titanium. Or if you've got a hip implant made out of titanium, or E-shore group, your E-shore is made of nickel titanium. Okay, and there can't be a problem. This document right here already explains why it can be a problem. In many cases, it is a problem. Titanium is not an inert metal. It will break down over time, and when it breaks down, it produces titanium ions that infiltrate the surrounding tissue, causing a chronic inflammatory response. So imagine that you have a localized, easiest way to imagine and remember it. You have a localized infection, an abscess that's chronically bothering you. Okay? Does your doctor say, oh, don't worry about that abscess. It'll eventually go away. No, they will aggressively try to manage you with antibiotics and try to remove the abscess. Okay, they're not going to tell you, oh, it's all in your head. They're not going to tell you, don't worry about it, it's going to go away. The reason that they tell you about biological implants, that there's nothing to worry about, is because a lack of knowledge about what biological implants do to the human body, and the lack of ability to do anything about it. Once you have a surgical clip, for example, the same thing applies to surgical clips. Once you have a surgical clip in place, most doctors will say, oh no, I'm not going to take out that surgical clip. It's too dangerous. My liability is too high. All right? Essure. Oh, I don't take out Essure. Or I'm going to, there's no problem with it. All right? Or like I said, anything that's in there as a biological implant. God forbid that you have a titanium metal implant that can't be removed. You're just looking down a terrible path of localized and chronic complications related to that, from an inflammatory response related to that. My point again, thank you so much for giving me the respect because I have a medical degree. But that only goes so far. All right? Always question your doctors as to the knowledge that they have related to the biological implants. And the first thing you can say, hey, I'd like to talk about the FDA report on biological responses to medical implants that you should have read as my doctor before you charged me $200 to $300 under my insurance to talk about Essure. Or something more specific, the FDA report on nictinol implants, which are nickel and titanium, which in there is Essure, which talks about the same problem. Remember, your doctor is charging you for his time, for his expertise. And in many cases, the deductible is huge. So you're paying $300, $500, $1,000 sometimes to your doctor for crap of information because he doesn't or she doesn't know what she's talking about. She's guessing and dismissing your needs and your concerns. So I know that I've gone on a little bit too long on this particular topic, but here's where I put the link in. Here's the link. Let's talk about this particular paper related to Felshi clips. And I picked this one specifically because of the age of the patient, how long she'd had her Felshi clips in, and how they managed her. First of all, the Felshi clip had been in place for more than 20 years. Number two, it had migrated from its original location. Number three, it had migrated and either been secondary to a hernia that was already formed as an inguinal hernia, or the migration of that Felshi clip into that area caused a hernia to form. All right? So they finally found the Felshi clip and were able to remove it. And then what did they do? They put a mesh in that place to be able to treat that hernia. So now you've got one biological implant that caused all those problems or was associated with problems. And number two, you put in a mesh to treat it. So where was the problems there? Was the patient properly informed at the beginning related to her Felshi clip as a biological implant and the high probability? Here's the other thing that I get upset about. All of the reports that I've read related to Felshi clips, except for one, says that the occurrence of migration of a Felshi clip is very rare. Okay, less than 1 in 1,000 according to some details, or 1 in 300. That's not the numbers that we generally see. That's the reason why your doctors put 2 Felshi clips on your fallopian tubes related to management, because they know that one of them may fall off. Okay? Here's another point. Migrating Felshi clips are like shrapnel that migrate around the pelvis, and every time they touch anything near it on a surface level, the body wants to reject it, causing an inflammatory response. If that Felshi clip is in the wrong place at the wrong time, it can erode into intestinal tissue. There's another story we'll go over that it erodes into the bladder. Okay, here, the story that I present today, it eroded, or it either eroded and caused a hernia or was subsequently found in a hernia. Can you imagine that, finding a Felshi clip in an inguinal hernia? The same thing applies to E-shore. If there's too many E-shores, or if the E-shore is in the wrong place, it can migrate outside of the fallopian tube and cause a chronic inflammatory response anywhere else that the E-shore is located. How is this associated with other things? One of the greatest examples, other than E-shore, are breast implants. The most common foreign body reaction associated with breast implants is the capsular contracture, where the body tries to wall off that implant. Now, that's perfectly normal as a category 1 or a stage 1 capsular contracture. But after that, the body, especially in the worst cases, tries to wall off the implant, squeezes really hard on the implant, and the implant can actually come right through the skin, just pushes it right through the skin. That's the same concept that's associated with biological implants everywhere else, whether or not it's a stent where it'll erode through a vessel, whether or not it's a urethral stent where it'll erode through the urethra itself or the ureters, okay? Whether or not it's the E-shore, which will migrate or erode through the fallopian tube, whether or not it's vaginal mesh, which will erode through vaginal tissue or tension-free tape. One of the most horrendous things that I've seen still commonly done is the fact that urogynecologists and gynecologists in general still promote the use of urethral meshes as a gold standard when they know that they cause significant complications. The majority of women that have urethral tapes placed to manage urinary incontinence are not being told that there are serious complications associated with those urethral meshes. And that if there is a complication, very, very few doctors are qualified to remove it. I keep saying this story over and over and over again. Informed consent. There's also some stories where I read that this is medical battery. Yes, if you're not properly informed of the complications associated with your biological implant, that is medical battery. Here is a final thing that I want to stress so much to everyone that watches, and please share this, is this fact. The reason why informed consent is so lacking is the assumption that the doctor doesn't have to tell you everything. Oh, that's just too much to tell them. It's just going to confuse them, and, you know, it may delay surgery. So I'm just going to tell them enough that they understand, but not enough, not everything, so that it scares you away, scares the patient away. That is absurd, fundamentally absurd. It is beneath any common normal person to say, I'm not going to give you as much information as I can, okay? It's distasteful, okay? So the point is this, that will continue as the standard of care for doctors until patients say enough is enough, start notifying medical boards, start calling lawyers, and say, you know what, this doctor put in a surgical clip without me knowing about it. This doctor put in a Felshi clip without me knowing about it. This doctor put in an E-shore without me knowing about it or explaining it to me. And what do? And lawyers will say, you know what, well, since that's the standard of care, we're not going to be able to sue you, so you sit a dead end there. But what happens is this, you can call your insurance company and complain. You can call the state medical boards and complain. You can even call your local news stations and say, you know what, I'm not the only person that it's had to suffer this way. We need to change how we manage patients. And there's great article that was written in the New York Times related to medical gaslighting, and that's exactly what you're suffering from. If you are one of the patients that has suffered from the complications associated with a biological implant without being told the entire story of that biological implant, your doctor has been medically gaslighting you. That's medical gaslighting. So let's talk. I'm going to post the story related to the Felshi clip, And like I said, the only way that you're going to believe what I have to say is to go one story at a time and understand what that's all about. Thanks so much for watching. Have a great Sunday. Take care.